So looking at ACL injuries, we know that about 70% of the time these injuries are non-contact. And there's certain factors that we tend to see in ACL injuries as far as the body positions that are going to tend to create that ACL tear. So typical factors we're going to see are oftentimes an abducted hip, meaning the leg is reaching out away from the center of gravity. So we're going to see an abducted hip and oftentimes an externally rotated foot. So if I want to plant and change direction this way and I plant my foot may be turned out, and then as I go to turn, that can put stress on the ACL. Other thing we'll see is the knee tends to be flexed less than 30 degrees. So when the leg is planted, it tends to be relatively stiff when these injuries occur. Usually it's not going to happen if there's a little more of a knee bend and a little more give right there. So that's one thing we're going to teach our athletes, is to really bend the knees when they cut and change direction. So we tend to see the hip abducted, foot turned out, and then we see a little less bend in the knee. Also, we'll oftentimes see a lateral trunk tilt. So we might see the trunk tilted towards the side of the plant leg. That can cause the knee then to collapse inward and again put more stress on the ACL. Other things we'll see is posterior ground reaction force. So a lot of times when a person plants and reach that leg out in front, there's a lot of energy coming back up against the ground, and that will oftentimes increase quad, kind of the quad demands, and then the knee, if it's not strong enough, will tend to give and rotate in. And lastly, and it's probably the most classic thing that we think about, is just an internally rotated femur. So anytime that knee tends to rotate or pivot in, it puts a rotational stress on the knee that tends to increase our ACL injury risk.